October is Breast Cancer Awareness Month. The CDC says breast cancer is the second most common cancer among women in the United States, and it's the second leading cause of cancer death among women in the United States. We're sitting down now with Mercy Health Dr. Nicole Reyes. She is a breast surgical oncologist to talk about breast cancer here in the Mahoning Valley and the prevention as we try to spread awareness. Doctor, thank you so much for being here.
Yeah, thank you so much for having me. I appreciate it.
Yeah, it's a busy month. It's Breast Cancer Awareness Month. Explain the screenings that are offered. Are they efficient enough to catch signs of cancer?
Yeah, absolutely. So the gold standard for breast cancer screening are screening mammograms, very effective at catching cancer very early. In fact, mammograms can catch cancer about 2 years earlier than when it might actually be felt in someone's breast. So very effective in catching cancer early.
And what would you stress to women? What's the age range? When should they make those appointments?
Yeah, absolutely. So most at average risk women should be starting mammograms at the age of 40. They should be getting them done every single year. Some women may be considered high risk depending on family history, other things like that. If that's the case, they should absolutely talk to their healthcare provider because they may be eligible for starting screenings a little bit earlier.
Yeah, would you say if you've got, a relative or a parent that had breast cancer, would you do mammograms earlier on, or how do you recommend things?
Yeah, so it just depends. So when we look at risk factors, there's multiple different risk factors, and usually it's they add up to determine what type of or what risk a woman has of getting breast cancer.
Okay. Now talk about those self-exams. How often should you be doing those, and what do you need to be looking for? I think a lot of us ladies, we Google, we're like, okay, what should it feel like, or how do you do that, right?
Yeah, absolutely. So yeah, a lot of women come into my office and they have a difficult time with self-exams because they are difficult. So what I usually tell my patients is, kind of stand in the mirror, look at yourself, look to see if there's any asymmetries on either side. What they're feeling for is any new palpable masses. They're looking for any skin changes like skin redness or skin thickening, things like that. If someone is having any nipple discharge, especially if it's bloody, that's absolutely something that you should tell your healthcare provider about. What I tell women, like I said, since self-exams can be quite difficult, the biggest thing that I tell my patients is that they should breast awareness, essentially know their breasts. That way they will know if something changes, and that's when they should tell their healthcare provider.
What's the most common type of breast cancer that you're seeing locally and that you normally treat?
Yeah, so actually nationwide, what we're seeing is that the breast cancer incidence is increasing by 1% each year. However, most of those are now localized cases, meaning that they have not left the breast, so very treatable. Another good thing that we're seeing is that the breast cancer death rate has actually decreased by 44% since 1989, which is tremendous. And that's due a lot because of advancements in treatments as well as better screening detection.
And would you say that we've got enough treatment options locally? Do you feel like you're, seeing things ahead of time enough to treat the patient sooner?
Absolutely, yeah. So most of the cancers that we see are still in women that are 40 and older, which is why it's so important to start screening mammograms at that age. But again, most of the cancers that we're seeing are localized, meaning that they have not spread anywhere else, which means that they are very treatable.
And we've got the mammograms, we've got the self-checks. Anything else women can do to prevent breast cancer with their own health and their own actions?
Yeah, absolutely. So a lot of my patients ask me this. Best things that they can do are lead a healthy lifestyle, eat a healthy diet, maintain a healthy weight, try and exercise regularly, refrain from smoking, limit alcohol intake, things like that. And then something that I always tell women, our family history is always changing, so make sure they're aware of their family history because like we talked about, family history can play a role in risk.
And like you and I were talking about off camera, the older women are pregnant, sometimes they're seeing more risk of cancers.
Yeah, unfortunately.
So make sure you're checking. Okay, well, thank you so much, Dr. Reyes. Great information, great advice.
Yeah, thank you for having me.
Absolutely.